I would like to introduce my friend and colleague, Dr. Allison Betts. I actually had the pleasure of training with Dr. Betts throughout my graduate program at Utah State University, and she was also one of my mentors. So she graduated with her doctorate at Utah State University, trained at the University of Nebraska Medical Center, Munroe-Meyer Institute, and also served as an assistant professor at the Florida Institute of Technology. So Allison is joining us here today to provide us with a presentation from an OBM perspective on training and supervision. Well, welcome, Allison.
Thank you, Joy. Thank you guys for having me. I was excited to do this, and the fact that you guys were open to doing a little bit different spin on presentation. Typically, I do a lot on assessment and treatment of problem behavior, verbal behavior, and those are all my passions, but this is also another one of my passions. So a little bit different of a spin today. We're going to be talking a little bit about the supervision and taking the organizational perspective, but also I want to kind of, it's somewhat of a philosophical presentation, because really what I want you guys to do is recognize and understand that you already have the tools and knowledge to change behavior in terms of organization, behavior management, staff performance, team performance, employee performance through your supervision, because you guys know the fundamental basics of behavior change. So just a little bit more about myself, expanding on what Joy had already said. I earned my master's, my undergrad and master's actually at Western Michigan University. And it was in my master's degree program, undergrad actually, that I got interested in behavior analysis, and particularly developmental disabilities, but also organizational behavior management. My master's is actually in a dual, it's a dual master's is what they called it, where I had a specialty in developmental disability as well as organizational behavior management. And I was very lucky to work through the 6 years I was there with a wonderful OBM faculty, John Austin, Alice Dickinson, as well as the clinical side. So I really got, from the beginning of my behavior analysis career, got a broad aspect of what behavior change can look like and across multiple settings. Then I went on to earn my PhD at Utah State University. And what we did there as part of our graduate assistantship was basically went into schools and school districts and taught this current staff. So we're talking school psychologists, PTs, OTs, speech paths, special ed teachers, gen ed teachers. We're teaching them how to start and run a behavioral classroom for kids with autism, some of which did the one-on-one training. My first experience down in St. George was we created an entire preschool program that was a integrative model that went from more restrictive to least restrictive integrative classroom. So very large system changes to sometimes just small, little classroom-based things. But that's when I really started noticing the benefit of the organizational background that I had, because I started realizing as a behavior analyst, when I first graduated with my master's, I thought, yay, I'm going to go in and I get to case manage for these cute little kids and get them talking and all those things. And more I started realizing that it was going to be more of me monitoring other people do that. And the skills that I learned on the organizational side, I think really helped me succeed in that type of environment, especially in the schools where you're fighting against a lot of people who may not want to be doing what you're asking. So this isn't just training other behavior analysts. This is telling people, I'm being paid to tell you what to do, and I know you don't want to do it, but you have to. So really learning that sales kind of spin on things and how to influence behavior change in some of those uncomfortable situations. I then went on to do my postdoctorate fellowship in the severe behavior program. And again, the majority of my responsibilities there was supervising the staff and monitoring the staff. And so more and more, I just realized that these are the skills that we really need to be focusing on and training our behavior analysts, because that's what their 90% of their job is going to be. And surprisingly, throughout the last 10 years or so, I have been surprised about how little training we get as behavior analysts in this type of field. Now, they have since back way long ago when I took the exam, when it was still pencil and paper, if that ages me at all. We didn't have the supervision section on the task list. So we're getting improvements as a field and understanding and noticing that it's more than just knowing how to program for a kid with autism or how to teach a behavior to an adult with dementia or something like that. It's about living as a behavior analyst and staying true to the philosophy. So that's really what this talk is going to be about. After I did my postdoc, I was appointed faculty, and I was on the faculty at Florida Institute of Technology for 6 years. And that was probably the closest I got to seeing how I think FIT has one of the best, well-rounded training programs in that they offer a lot of organizational behavior management. They have a lot of people who do work with adults with dementia and kids with autism. So I was really excited for that and to develop that, and seeing programs like that develop where our students at FIT are required to take organizational behavior management courses and beyond just what is in the task covered in the task list. After I was at FIT for about 6 years, and I started kind of questioning and thinking, I could make a bigger change, and why not develop a gold standard model here in Florida of how we can train our behavior analysts and how we can run a program, a behavioral program, not just for kids with autism, a behavioral program in general. So I recently, last year, I had the opportunity to start a center, the Center for Autism Research and Education, and I'm able to use again, those skills and knowledge on the organizational side. So what I want to do, and the reason why I kind of went over this history, so you can kind of see where I'm coming from when I talk about these things throughout the presentation, and that although I have more extensive training in the organizational side of things, you don't need that because it's very similar to what we're doing. It's just learning how to view behavior as though you're viewing the behavior of your client. I'm looking at all behavior in the same way. So what I've learned, thinking about, these are kind of questions that I started thinking about throughout the years. What makes a behavior analyst stellar? What makes somebody you think, when you hear their name or you see them behaving, you think, wow, they are a good behavior analyst? And what are those characteristics that we all aspire to be? I have particular mentors that I kind of strive to work toward being somebody similar to that. For me, it's Linda LeBlanc, who is a mentor of mine at Western, and Kathleen Piazza and Wayne Fisher, and these people who have made such great changes in our field and advances in our field. But what are those characteristics? Why do we look at certain people and see and say, like, wow, they're a good behavior analyst, so I really want to be where they are in 10 whatever years? Why do we love working for somebody or working with somebody or being around somebody? So forget work for a second. What makes us like somebody? Well, they deliver or provide us with reinforcers, right? And we might not be thinking about this on a daily basis. It comes naturally, but what's reinforcing for us is what our friends, significant others provide for us, right? Otherwise, we wouldn't hang out with them. So how do we use that kind of information to advance our behavioral skills outside of just working with clients? So when I started thinking about that, and along with some of the other questions, I realized that the people, particularly Linda and Kathleen, the people that I kind of look up to and aspire to be, and the people that I think, wow, they are really good behavior analysts, are behavior analysts to the core, I guess you could say. They don't leave the job and leave behavior analysis at the job. And I'm sure we've all worked for people who are like that, who you're like, man, you know, they're behavior analysts, they don't see what they're doing, kind of thing. So constantly evaluating behavior to improve relationships with other people is really what we're talking about. In this context, I'm going to talk about supervision, but you can really take this and extend it into other aspects of your life. And if I had more time, I would expand on that. I'm doing a presentation at Ohio ABA on something similar, but expanding into things that I've done for myself, self-monitoring, self-management at home for the gym and, you know, writing and all those kind of things, but also for my daughter who's 3, and you probably might be able to hear in the background at some point, in my relationships with my friends and things like that. So really, again, we're going to talk about the supervision, but keeping an open mind to these are things that you could do in a way that you could look at any type of behavior in any relationship. So one of the main things that I think in terms of a supervisor, whether it's a director of a center, whether it's going to be somebody, a new BCBA supervising a team, whether it's going to be a behavior analyst training a parent, one of the things that I've noticed is how that person leads. And it's not this, I like this little kind of meme if you haven't seen it before. It's not somebody sitting up on the ivory tower or in their office saying, do this, do this, do this, you need to do this, here's our mission, move forward. It's somebody who is going to jump in front and say, here, let me help you, let me show you, let me tell you what to do, let me be involved. And if you think about how we change behavior, that's what we need to do. We know that just sitting there telling somebody something or how to do something is not going to be effective, right? So really, the people that aspire me and that my supervision style is influenced by are those people who really get in the trenches and kind of are there to show you and support you, not just tell you what to do. So thinking about taking a step into kind of more familiar territory, now think, okay, what makes somebody a good case manager or lead therapist or whatever the name is in your setting? As a behavior analyst, you know, here we're called lead therapists, behavior analysts, case managers, whatever it might be. What makes somebody good at a good case management? How can we use these skills outside of case management? And then we're going to talk about techniques that can help you become a better X, Y, or Z. So these are things, again, that we're going to focus on supervision, but you could insert whatever you want, because the final kind of tips that I've provided toward the end are things that you can use with any kind of interaction or relationship. So this is kind of the overview of where we're going with the presentation today. Okay, so we know that we can analyze any behavior or performance behaviorally, right? We have the ABCs of behavior. We know we can look at what comes before the behavior. We can talk about and describe the behavior, what the consequences are. So as case managers and behavior analysts working with our whatever population, we know how to do this. We know, I mean, we could probably do this in our sleep. We could tell somebody how to take ABC data, get the function of behavior, find preferences, find reinforcers, all of those things. So why aren't we using this on a broader scheme and in other aspects of life? And there are actually a lot of people who do this outside. So take away the behavior analysts, especially those who focus in organizational behavior management. There are still people who do this, and these are just some examples of books that I highly encourage people to read as examples of how people have made changes in behavior and made, you know, careers out of this that aren't necessarily behavior analysts, but understand the impact that the environment has on behavior and are out there. Marshall Goldsmith, he's an amazing leadership consultant. He was trained as an IO psychologist, but was at UCLA in the time of Lovaas, and so had some behavioral influence. In this book, Trigger specifically, I mean, he's basically talking about antecedent-based interventions and identifying things in the environment that are going to evoke certain behavior and then changing those, and then providing positive consequences when the behavior changes. That is what we do. So if people are doing this, people are very successful in other organizations. His whole career, Marshall Goldsmith, is working with top leaders in organizations. So think if there's any behavior that's hard to change, it's got to be like a CEO of a Fortune 500 company. But he can do it, and that's what his specialty is. Amy Sutherland, if you haven't read this, it's a really quick read. I actually used to require my students to read it, undergrads. I sat down in like Barnes & Noble one day and read the whole thing. What Shamu taught me about love, life, and marriage. She's an animal trainer, journalist that talks about learning how to train animals, and just stumbled upon this animal training. I think it was for the movies, was training like lions or something for the movies. And he was explaining the principles of behavior, and she kind of thought, wow, if that works on lions, why wouldn't it work on my husband? And the whole book is how she used this effect of how animal training to make her relationship with her husband better. So again, but just by manipulating her behavior and how she responds to her husband's behavior, they were able to have a better relationship. So that's a really good book as well. And then Nudge is on the behavioral economics side, and this is how you can make small changes to improve health, wealth, happiness, and this goes even to larger scale changes. One of the things that they talk about is by putting a simple antecedent intervention. I think it was in a Japanese airport. They engraved what looked like a smashed fly or mosquito into the urinals in the men's bathroom, and the amount of urine that was on the floor surrounding surrounding the urinals decreased by like 80-something%. It was insane because that simple intervention caused them to aim better or whatever it might be. So things like that where you can change behavior by changing the environment. People are using this all over the place. So the purpose of this is to show that it's not a new thought, it's not a new theory. People are using this, and it is possible, and it's very effective. We know this. We can see it with our clients. So my question is, why aren't we using the same principles and the same procedures that we do with our clients to change behavior of our staff when needed? So let's think about this in terms of the steps in behavior management. This is pretty basic. You guys are probably all familiar, maybe a slight modification of this. So we notice there's a problem behavior with a client, right? So it could be self-injury, it could be aggression, it could be talk-outs, non-compliance, whatever it might be. There's a reported problem. So what do? We observe. We might do some informal assessments and just kind of sit back and see, kind of start developing our operational definitions, figuring out what we're looking at, maybe even determining, is this a problem at all? Depending on who reported it, it might be that we just have to actually get some data quickly to see if it's something that we need to intervene upon. From there, we develop probably a formal functional assessment procedure. This could be a functional analysis. This could be descriptive assessment. This could be observations. It could even be questionnaires and interventions, the FAST, whatever it might be, to identify the function of the problem behavior. So whatever method we choose and whatever is going to be most successful, could be a combination. We're going to put that in place to identify the function of the problem behavior, why that individual is engaging in the behavior. From that, we determine the function and to design and implement a function-based treatment. This should be nothing new to you guys. These are steps we do in our sleep. And sometimes it's like when someone asks you what are the steps, you might be like, oh my goodness, how do I even describe it? Because it's habit, right? It's second nature. You just kind of know what you're supposed to do. So we sometimes these, the functional assessment in getting to the treatment is a little more tricky than others. Sometimes it's very clear cut. There's some really interesting research going on. I'm not sure what's published yet, but Claudia Dozier from University of Kansas is doing some stuff where she's actually looked to see if behavior analysts are able to identify the function reliably through more of a informant assessment like the FAST. And what she found is that like 90-something%, a good chunk of behavior analysts with a good amount of experience were able to watch an individual for 30 minutes and with the FAST, conduct a FAST with a caregiver, was accurately able to identify a function. Now, not every problem, behavior, or situation is going to be that easy. We definitely all have had kids, for those of you who work with severe behavior and severe behavior units with functional analyses, you know that there's sometimes almost their whole admission, their first portion of it is going to be just figuring out the function. So sometimes that can take a really long time. So it really depends, but this is the most important part. So getting this part right is going to be the whether you succeed or fail. And this is the same when we're talking about staff performance. Once we intervene, we monitor, we take data, we monitor progress, we graph the data, we make sure that it's effective. And if it's not, we revise. So if we're not seeing the behavior change we need, we change something about our treatment systematically. Then we go back to monitoring and evaluating. And if it's still not working, we change something else. And this is a constant kind of cycle that we go through, right? Once we get the behavior at desired levels, we program for maintenance and generalization and make sure that the individual is going to maintain this behavior change in new environments with new people, at a thinner schedule of reinforcement with less prompting, whatever it might be. We definitely need to make sure it maintains. So these are steps that you guys are all familiar with, yeah? So what we're gonna do is talk about how this is incorporated into your supervision. So the purpose to kind of go through that is you're kind of like, yeah, right, I know this. What's the point? The point being is if you knew those steps in solving a problem behavior for your client, you know how to change behavior. You know how to do it. And so many of us, as I said before, at least those that I have encountered, fail to systematically implement behavior change procedures with supervisees or trainees or employees the way we would with our clients. And what's so interesting is we even more so, some people, I shouldn't say we, some individuals even more so actually go as far as to engaging in behaviors and verbal behavior that we tell our students to avoid. So victim blaming and saying, well, they should do their job because that's their job. Well, do we say that about our clients? Well, they should not hit their head because that's going to hurt them. Well, no, there's obviously contingencies in the environment that are supporting the current behavior. And what our job to do is to figure out what those are, to help break down that part of the environment, or manipulate and change that prior environment to get better behavior. So when we have employees that have poor performance, and I would even say, I mean, obviously you're not going to go through behavior change if you have employees that are doing exceptionally well. But some of this is still true because we definitely, as with a lot of, if you work in the schools, you'll see this a lot where the good kids are kind of forgotten about, right? And we take for granted the good behavior. I see myself doing this, and I have to catch myself with my daughter, that when she is polite and when she does ask nicely and when she does listen, we have to make sure we're still engaging in that, some of the things that we would to make sure those behaviors maintain. So they're reinforcing those behaviors. But what happens when we have individuals with a poor performance is what we're going to focus on. So what are some common performance problems that you guys might see? These are just some that I came up with that we see in our center and that I've seen across the board with technicians, with the places that I've worked. So tardiness, treatment integrity issues, obviously, is a big one. Turning in any kind of documents late. So whether it's a behavior analyst, you're a director and you're overseeing other behavior analysts, whether it's a BCABA, whether it's, if you have your text graphing data, or doing something on the BIP or whatever it might be, creating data sheets, whatever. Turning things in late, low quality products. So when they do turn them in, maybe it's not done to the ability. There's missing sections of the behavior plan, or the one that I always am so surprised about, but all we see is the grammar issues. Now there's spell check and it's so easy, but you still get a lot of that. So those are the things that you can easily kind of find within any environment. And then even consistency. So a lot of times what we might do is we maybe give feedback, tell them to do something, it improves for a little bit, and then it drops off. Okay, so we know that they have the ability to change behavior, but it doesn't necessarily maintain. So these are just ones that I thought of that could happen, that are all going to be problem behaviors that will, I think, and have been in the past, in my experience, not easily, but able to be changed and influenced through these procedures that we're going to talk about. So when I really started looking at employee performance, employee problem behavior as problem behavior, I was sitting, I think I was my first year in a faculty, maybe second year in the faculty position at Florida Tech. And we had invited Dr. LeBlanc down to do a presentation for some conference. And myself and another colleague who is new, she came in at the same time. We were junior faculty. We're sitting out to dinner with her and complaining about one of our graduate students or something. And just, man, she just is not getting what she needs to get done. She's just aversive. We don't like working with her, whatever it was that we were saying. And we just don't know what to do anymore. And Linda looked back, she sat back and she said, ladies, you guys are both experts in problem behavior. I studied with Wayne Fisher. My colleague studied with Brian Iwata. Out of anyone, we know problem behavior. And we're kind of looking at her. And it took us a minute and then the light bulb went off. She's like, this is problem behavior. Why aren't you looking at it as you would any other behavior for your client? And so she kind of, ever since that kind of light bulb epiphany moment, whenever I have a behavior of an employee or a student or something that either it's something I don't want to see or it's a deficit, I do this same thing. I think, okay, this is a problem behavior. What do I do? So that kind of is how I kind of changed my thought process on how to address employee performance. So going back to these steps, you can insert, as I did on the top title here, you can insert steps in employee behavior management. It's the same thing. You notice a problem behavior, it's reported to you, somebody comes to you as a supervisor or you see it, a parent might say something if you're in homes. You do observations during supervision, maybe informal assessments, talk to people, get information about how persistent this problem is, how often it's happening. Do other people have the same issues with the staff? Maybe they work with multiple families wanting to see if it's happening across the board. You need to do a formal functional assessment sometimes, and at some capacity do a formal functional assessment, but how formal that is, we'll talk about in a minute. And then based on your assessment of why the problem behavior is occurring, you put in a function-based treatment. Monitor the progress. So this is where, so most of the people, when they do have kind of a behavioral spin on employee performance, this is where it falls off. So a lot of times behavior analysts are great at the first part, especially during supervision. You see an integrity issue, for example, you figure out why it's happening. So did they not read the protocol? Where you did it, maybe they weren't trained well enough. So maybe it's a skill deficit. Maybe it's a motivational issue, or maybe there's an environmental arrangement issue. You fix the problem, Feedback. It might be as simple as providing feedback. Where most things fall apart is the monitoring, the systematic monitoring of progress of that behavior change and revising, follow-up in programming for maintenance. So you can't expect to tell an employee to do something different and walk away and never address that issue again, or wait 3 or 4 months until it becomes a problem again. So you have to develop the environment and change the environment in a way that will support sustained behavior change. So we're not just talking about that momentary change. We need to see sustained behavior change. So again, if you're talking about a client and you teach them a new skill, you're not immediately going to master that skill and never touch it again. You're going to ensure that it maintains. You're going to assess for generalization first off and make sure that they can do it across multiple environments and so on and so forth. And you should be scheduling for maintenance. So what does that mean? Well, you remove the support. So you're prompt fading. You're thinning your schedule of reinforcement. So not only are you removing prompts, you're removing reinforcement. And then maybe then you thin the schedule of practice, right? Or checkups. So maybe instead of doing it every day, you go to once a week and then once a month, and then it's just in the natural environment. That should be the same way that we address the problem behavior. Through that revising, and once we get the behavior change we need from our employee, we need to schedule follow-ups. We need to schedule a formal behavior plan to make sure that the behavior is going to maintain at the levels that we want. The desired performance is going to maintain. So assessing behavior, basically for the employees, you want to see if it's going to be a skill deficit or a performance issue. A lot of times you might hear this being discussed as a can't do versus won't do problem. So if it's a can't do, it's a training deficit. They probably maybe don't know what they're supposed to be doing, or that they might not know that what they're doing is inappropriate or incorrect in whatever way. Performance issue is more when an individual knows what they should be doing, and it's more of the lack of motivation, perhaps. So the contingencies don't support whatever the response effort might be, right? It could be competing contingencies. So if I had the time, or if I didn't have to do all these other things, yeah, I definitely would take the data on the problem behavior, but I also have to take data on manning and tacting in the natural environment and parents' performance. So I can't take the data on the problem behavior. Our environment doesn't support that. And then potentially the lack of resources. So maybe you're asking them to do something that they actually can't do for whatever reason. It could be as simple as they didn't have the data sheet printed, or no one gave them the protocol, or it could be that you're asking them. There was one time when I was working at the Scott Center at Florida Tech where we were having a huge discussion about why people weren't wearing gloves in the bathroom or something like that, staff. And someone raised their hand and said, there are no gloves in the bathroom. So it's like there's a resource issue that could be easily fixed. So you kind of have to look at all of these things. To really identify this, you have to do some sort of an assessment. This could be just simple as observation, figuring it out, informal interviews, or you could do a more formal assessment. I was lucky to be able to be involved with some of the studies on the PDCHS. I'm not sure if you guys have heard of this, but it's the Performance Diagnostic Checklist modified for human services. So in the 90s, late 90s, I think early 2000s, John Austin developed the Performance Diagnostic Checklist that was used as a functional assessment tool, similar to like the FAST, in organizations as a way to determine why an employee performance issue is occurring. More recently, in 2013, Carl Wilder and some of their students modified this particularly for human service setting, because some of the stuff on the PDC, the original PDCHS, was not particularly applicable to our type of setting. And there were some other restrictions that may be happening, or environmental things that may be occurring that aren't in a typical arrangement when you're in human service, particularly non-for-profit. So if those of you who aren't familiar with this, I just kind of posted some examples. You can get the entire PDCHS. It's available through Behavior Analysis and Practice. It's this, I have the reference at the end of the slide, but it's the issue. It's, I think, 2013 issue, volume 6, issue 1, or something like that. So they actually have it, and you can read some of the research that has been done on it since then. But here are the categories and some examples of questions you might see. So basically, you ask people, the way that they've done it is they ask supervisors. So if there's an employee problem, let's say on the technician level with your RBTs, they might ask supervisors, direct supervisors. They might ask the director. Maybe if there's a director of training, they might interview them. One thing that I have noticed on this is that, and this might just be because of research sake, and I've been observing it more for research than I was for clinically, but why not just ask the technician some of these things as well? Or even maybe if you have one particular or a small set of techs that have employee problems, maybe you can ask other technicians what they think of these, particularly with training. So was the employee formally trained on the task? Well, if you ask me who is in charge of training, I would say, well, yeah, of course. I mean, because I did the training, you know. So you might, by asking some of more than just one supervisor, you get a little bit better of a description of what's happening. Just as the same as with the FAST, you would ask mom, you might ask dad, you might ask the teacher, and you might ask maybe their behavior analyst or a tech or SLP. So you get multiple inputs through that. Can the employee accurately describe the target task? In my mind, or in my opinion, you just ask them when you're doing this, tell me what you're supposed to be doing, and then you check yes or no if they can do it. Some of the task clarification and prompting. So have they been informed that this is what was expected? Can they state the purpose of the task? Why are we doing it? Is there any kind of job aid, a checklist, anything visibly located in the area in which the task should be performed? Is the employee verbally, textually, electronically reminded to complete the task? So this is looking at kind of, again, the task clarification checklist or antecedent-based kind of prompts, signs, postings, things like that. Resources, materials, and processes. These are a couple of questions. I didn't leave them off on purpose. It was just kind of hard to get it all on the slide, but this is, do they have the available materials necessary to complete the task? Do they know the process involved in completing the task? And oftentimes with behavior analysts, I see this as a major portion with the processes involved. If they don't know the entire system process of, let's say, getting an authorization, they might not know what they're supposed to do, or they might not understand the importance of doing something the way that we want them to do it, because they don't see how it influences or affects the entire process or other people getting their job done. That's what that means. Performance consequences, effort, and competition. There's more questions in this, but I just gave an example. Is the employee ever directly monitored by a supervisor? So indicate how often. Is there feedback provided, I think, is another one. Are there are contingencies that support the appropriate behavior, the desired performance, so reinforcement-based contingencies. So you have this assessment tool that's available. Whether you need to use it, maybe not, but if you're new to kind of identifying some of the issues that might be causing some performance problems with employees, it's at least a great reference tool of things. It's a prompt of questions that we should ask ourselves. These are all very similar questions. If you are familiar with any of the publications, one of my favorites to give to students is Summer Furioli. I forgot the year. I think it's maybe 2007. And it's a flow chart, a decision tree model for when you're troubleshooting discrete trial training. And it's like, does the kid have problem behavior, and are they responding? And based on their questions, you kind of go through and it helps you problem solve. Now, it's not like the perfect end all be all to troubleshooting things, but it gives new behavior analysts a tool and reminds them of questions I should be asking myself when I'm trying to solve a behavior problem. The PDCHS is something very similar to that. The cool thing is it also gives you ideas for intervention. So based on what your score is and what you identify as the assessment, it gives you suggestions for intervention. And it even gives you literature, articles to refer to that are examples of that type of intervention. So if you don't have a formal assessment like that, or maybe you're not interested in completing something like the PDCHS, you can do an individual or interview with the individual. You can interview people around them to get similar information. But again, if you're less familiar with some of the barriers to performance at an employee level, you might not know what questions to ask. So I encourage you to look at some of those assessments that are out there. And I would encourage you definitely to observe and take data on the behaviors that you're looking at and evaluate the context. So ABC data, when is this happening? In what context? What are the contingencies supporting the behavior? Now, this is sometimes difficult because we all know that when we're there, our employees behave probably differently than they would if we weren't watching. So getting kind of true data without being a little bit deceitful of like video cam taping while they don't know or something, it might be hard to really get an accurate depiction of their performance in the absence of their supervisor. Again, once you find the assessment, or once you determine the function, you have to develop your intervention plan. So if it's skill deficit, you're going to do some training. We use the BST model for training our parents and staff, and they have a high level of integrity checks that are required before they move to each step. And then once they do, then we train for generalization and test across the board. And then work toward the reinforcement systems. So keeping in mind, even if it's a deficit issue, the skill is still going to be very weak in the individual's repertoire when you're done training. So you need to continue to put supports in place and fade those supports systematically if you want the behavior to maintain. Motivational issues, there's a lot of different potential interventions for this, but basically identifying and modifying the contingencies that support the performance that you want to see, rearranging the environment if it's a competing contingency thing. So if they would rather be on their phone checking their text messages than working with their client, you get rid of the phone. So you have to kind of just look at an individual level for that. So I briefly mentioned this, but here's just an example of what we do for our training. And this is anytime we see a skill deficit. We also do this with parents for a training, initial training as well. So we repeatedly practice with prompts and reinforcement. So this would be analogous to our errorless teaching or errorless learning that we do use with our clients. We systematically fade our feedback. So here's our prompting and reinforcement schedule thinning. And then we decrease the supports and observation. So we go from maybe doing weekly checkups to maybe monthly checkups. And if they can maintain on the monthly basis, then we maybe say after 3 consecutive months, that's maintained and we consider the problem solved. And then if it comes up in an issue, we might have to do spot checks or something like that. But again, you can see that, and the reason why I put this in like here is because we solve the problems in the same way. You're using the same skills as you do with your clients. This is just an example for the sake of time. I'm going to skip through, but this is an example of what one of our training procedures or protocols looks like. Now, a note on a reinforcement. This is reinforcement is, I think, as adults, we don't provide enough of. We all like to be praised for the most part, depending on who it's coming from. We like to know when we're doing things well, but we don't use it a lot. And so this is one thing, if I want, like the one take home point that if you remember anything from this presentation is Differential reinforcement alone with employees can be very effective. I once had a practicum student write on an evaluation that, you know, he was surprised of how little reinforcement he received from his practicum site supervisors, given they were all behavior analysts and that's what they're told to do, and what the students are being trained on is a procedure to use to change behavior, yet they rarely ever as employees received reinforcement. And that kind of stuck with me, and kind of struck a note of that. You're right. Why do we always immediately go to the corrective feedback or just feedback alone? Why aren't we reinforcing behavior when we see it happen and shaping behavior in the context? So keeping that in mind, that positive reinforcement is very, very effective and powerful when used correctly on staff performance. Try spontaneous reinforcement. I'll talk a little bit more about this if we have time later, but if you are familiar with Aubrey Daniels or have read any of his books, he talks about this a lot. Spontaneous reinforcement and separating positive reinforcement from the corrective. Forget everything you've learned about the sandwich method. Research is now showing that that's not preferred. And in fact, people, when you use the sandwich method and when you deliver positive and corrective feedback together, most of the time, what the individual reports hearing is only the negative. They focus on the negative. It's kind of a human characteristic that we focus on that. So usually what I encourage my behavior analysts that work at the center to do when they're doing supervision is to, in the moment, differentially reinforce, provide immediate positive reinforcement, because again, the closer the reinforcement is delivered to the behavior, the more effective it is. So tell them right away, that was perfect. That's how you're supposed to be doing. That trial looked awesome. Or look, that was exactly what the prompting should look like. So they know exactly, there's examples, not just non-examples. Then if there's something that really needs to be discussed in terms of corrective feedback, determine if it is really needs to be said in that supervision meeting. If it is, we do our corrective feedback delayed. So we do a lot of positive reinforcement within the context of the session. And then when we're doing our kind of supervision meeting and kind of review of the supervision and reviewing our notes and things like that, that's when we provide the corrective feedback. So they're very separate. Don't forget about maintenance and generalization, collecting data and continuing to do spot checks. And data collection is very important. Again, this should all be sounding familiar because this is everything you tell your employees to do with their clients. We use very simple integrity check sheets, kind of like yes, no for a trial block or whatever, in our observation period we're watching. And if we notice there's a consistent problem, then we go to a more detailed treatment integrity check, like a trial by trial, component by component. It doesn't have to be a very cumbersome process if things are going well, but it has to catch whether things are going well. We also are now starting to implement peer observation. So individuals can watch, different techs can watch each other. Now we're at a center, so we can do that, but they can watch each other and quickly score each other, which one allows for more observations, and two allows for the individual to see other people demonstrate or observe the behavior. The biggest thing that I would suggest when you're looking at supervision or you're training a behavior analyst, especially a new behavior analyst, to do supervision, is to have a plan. Every supervision, whether it's observation, a team meeting, whatever it might be, everything should have an agenda. As a behavior analyst, you should already know what you're going to be looking at, review those documents, determine what needs to be reassessed for either maintenance or what needs to have a follow-up observation to see if behavior's improved. And then pick one new program or something to look at each observation period. All too often I see, and this is information I get a lot from, I got from practicum students and techs that were being supervised. I've gotten a lot of feedback saying that it doesn't seem like their supervision, it's good and they get good feedback, but it's not cohesive and it's not ongoing in that, like, there's little follow-up. And a supervisor could come in and they're kind of playing around with programs, and then they might give some informal feedback, but it's never really it's better when it's planned. And when I come in and say, okay, I need to see this program, and I'd like to see the child do A, B, or C. And knowing that, letting them know as a technician, letting them know, I'm going to observe you running these programs versus, hey, I need you to run this so I can watch the child's performance. So they know what the purpose of your supervision is. Being objective is key also. So taking data rather than just providing informal feedback. Try and do some sort of data collection every time you go in to do supervision. Again, it can be very quick, yes, no check sheets, but something objective with definitions. We talked about a lot of this. I know we're running out of time, but you can look at samples, finding what motivates your staff and doing preference assessments just like we do with our kids. Again, doing with the employees. When I have a new employee, I give them a survey. This is for a couple of reasons. One is I want to know what's reinforcing for them in terms of their job, because if I can use natural consequences and natural reinforcers to maintain good responding, I'm going to. I have one behavior analyst who loves to do research. I have one behavior analyst who loves the system side. The other one hates it. So I allocate their job tasks based on what they like to do when I can. Sometimes you can't, but if you have that choice, I refer back to this and see what they like to do. I also ask about what they like in terms of praise and feedback. Do they like to be publicly praised? We sometimes assume that people are going to like to be acknowledged in public, and that can actually function as a punisher. So make sure you know that what an individual likes, how they like to receive the feedback, whether they like praise from the supervisor, whether they like general praise, those kind of things. Do they like small treats, or do they find that kind of unnecessary? What would they prefer? Do they like pizza, or would they like to, a larger reinforcer or something later and earn something like a day off or whatnot? Or do they like small little things? And then I do like an edible preference assessment. This is because I like to do spontaneous pairing with myself. So if I know a majority of my employees love donuts, I try at least every couple weeks to bring in a box of donuts or order pizza for lunch. That's pairing me as a reinforcer, which is pairing their job with reinforcement, which is going to make them do better. So these are just examples that I included that you guys can see. We can, if you want, we can wrap up if you want to go for questions. There's just a little bit more about the corrective feedback and some stuff that we've already discussed.
Allison, thank you so much. That was a wonderful presentation, and we really appreciate your time. And I think that it really highlighted a lot of just different situations that all of our analysts within our organization probably encounter frequently, and gave people some great ideas. I guess I have one question though. So your real life example, what was the intervention that you and your colleague put in place for your graduate student?
We actually put her problem behavior. It was complaining on extinction. And we reinforced productivity through, she'd like to meet with people to talk about, meet with faculty to talk about what was going to get done. So we put the complaining on extinction, and we reinforced productivity by scheduling meetings when she had a product delivered. Mm-hmm. So it was pretty effective. She graduated. So.
That's the goal. Oh, wonderful. All right. Well, everybody enjoy your evening.